It's great to be back at CAD. It's been a number of years since I've been here. I always look forward to participating in Children's Advocacy Days when I did most of my work here within Tennessee, especially the interaction I get to have with such diverse and passionate colleagues from across the state. Today, I'm sure you've heard some compelling conversations and some great ideas at this year's CAD, and hopefully you've discovered some strategies that you can take back to your own community to further your work with your own family. I was asked to speak about systems of care. Now, that's a philosophy that you all should be very familiar with. Tennessee has had multiple federal grants over the last 20 years to build more coordinated systems, first in individual counties. We started with zip codes, actually, within Davidson County, then regionally, and now statewide. We know that systems of care work in our state and have lasting impact on both families and systems. The very first federally funded system of care site, the Nashville Connection, jump-started the family support specialist workforce that led to certification and eventually a billing process through TennCare for reimbursement of that service. It also promoted a more global understanding of the need to be culturally responsive in our work with families and established a statewide system of care group that became the Legislative Council on Children's Mental Health. It's also where 98% of enrolled children remained in their community in a family setting. 98%. The current federally funded sites under System of Care across Tennessee, which you probably know as SOCAT, that are helping children and youth remain in the home and out of state custody or detention, 90% of those involved are still at home. And even more important, caregiver strain has been significantly reduced. It hasn't just been federal System of Care grants in Tennessee. For example, the city of Memphis funded Just Care 180 a number of years ago. And it focused on 2 specific zip codes with high rates of juvenile court involvement. And that resulted in a 90% success rate in preventing further involvement of young teens in juvenile court. That's only 10% recidivism. Can you think of other programs that have that kind of success or use an approach that is that successful? And the use of the mental health liaison in schools in the Nashville Connection was adopted with funding from other sources, such as the Department of Education and other parts of the state, as families found that support with school-related issues was so valuable to them. What we've learned in Tennessee and nationally, and we're now sharing this internationally through systems of care work, is that partnership with families and among ourselves as providers and advocates works. Overall, there's many positive outcomes, as you can see here. Decreased clinical symptoms, decreased school behavioral issues and suspensions, decreased involvement with law enforcement and juvenile court, out-of-home placements decrease, and even caregiver strain. And that's critical, because that's a significant indicator for abuse, neglect, and the ability to maintain a child at home. There's increased daily functioning at home, school, and in community settings, increased school attendance and academic performance, the ability to maintain children and youth with behavioral challenges at home and in family settings where they can thrive. These outcomes mean that kids are functioning better at home and in their own communities, enhancing their opportunity to grow and thrive as they enter adulthood. This means that parents who once felt isolated and overwhelmed are once again connected to community and support systems, that they're able to stay at work, and they're learning skills to support the resiliency of their children and families. Isn't this what we're all striving for, both in our work and in our own families? However, even as I worked in the first system of care grant in Tennessee in 2002, started in 99, and now as I do this type of work nationally and internationally, I find that people still think of system of care as a program or that it is the responsibility of whoever has been awarded a system of care grant. How many of you had those thoughts? It's not. In fact, we often make the system of care approach look and sound complicated, kind of like this. System of care is not a program. It doesn't belong to any one organization or entity. System of care isn't wraparound, although wraparound is an excellent tool that is used in a lot of coordinated system of care sites. System of care is how you work with children, youth, and families, and with each other. It is your approach in whatever role, position, or job that you have. You have an opportunity to make a difference at the point of your involvement with a child and family. It could be direct, if you're doing direct service with a family, or it could be as an administrator or a policy maker in the work that you do that will impact families. It's how you approach all the functions of a system of care for children and their families. It's not a grant. These are some of the functions up here. Although federal funding for systems of care is often used to pilot services and supports that operate under this particular philosophy, systems of care are not all about providing direct services. It's the easiest way to see things changing, but that's not really what it's all about. Instead, it's the approach you take in planning what services are needed, creating financing mechanisms that increase access, such as Medicaid waivers to fund services, and making sure that there are well-trained providers to deliver services and that there's care coordination to help with that and crisis services in place that work for families. This way of doing business involves working together, regardless of what your role is, to build systems and offer services in ways that are family and youth-driven, community-based, and culturally responsive. Truly, system of care is a set of values and principles that you hold, and that provides a framework for the way that you do your work with children, youth, and families. So I want to ask you to step back for just a minute. I want you to think about why you got into this work, and honestly, why you continue to do it, because it's not easy. Was it a calling? Did you want to help others? Were you interested in making a difference somehow? Or do you just care about children and how they grow up? For me, I was always drawn to psychology, children's mental health. I felt that there was an opportunity there to make a difference so those kids grew up to be productive adults and that their parents had hope and built their own skills and were connected back to their own communities. Well, I have to admit that I also was a pretty horrible child to my parents, and this is another way I can make that up to them. Trying to make some type of positive impact. I apologize on a daily basis. I don't know how my mom still likes me. She does. Whether you got into this work intentionally, like I did, or if you just sort of fell into it and you found your place doing this type of work, your role in what you individually do is important. And in some way, it impacts a child, a teenager, an entire family. Although you have mandates in whatever system you work in, what organization you work for, about what you do in your role, it's really how you do your job that's the key to making a positive impact and in contributing to your part of building, your part of a puzzle that creates that full picture of service and support for a child and his or her family. Viewing system of care as an approach and as more of a way of doing business, not just with families again, with each other. Let's consider what that looks like for you. Let's start with the most easily seen way that a system of care is operationalized. That's those direct services. So if you are a clinician or a case manager, a family support specialist, a teacher, a probation officer, or really anyone who works directly with a child or a family, a system of care approach may look like this for you. These are some strategies you can use. Meet families where they are. And I mean physically, emotionally, and developmentally. Every family is different. Treat the whole child. That means looking beyond a diagnosis or a delinquency charge, as well as considering the impacts on and the needs of the siblings and the rest of the family. Let me give you an example. A child coming into juvenile court. Young man had a lot of anger, a lot of acting out behavior. The PO, probation officer, dug in a little bit more to find out what was going on. And he discovered that this anger and this acting out was tied to his inability to read. It was a way to distract from what the core issue was. And he was embarrassed, and he was ashamed about that, and he was angry. He addressed that core problem going on with this child. Rather than sending him to anger management classes, kind of a cookie cutter approach, he addressed how to help him learn, tutor, reading classes away from his peers so that he wasn't embarrassed, found opportunities for him to use what he was reading, and the anger and the behavioral issues started to dissipate. Treat the whole child. Respecting the expertise of families regarding their children, including their goals and their choices. Our goal should be to provide them with information and options so that they can make the best choices that fit their child and family, and we can work with them to help them achieve that. Taking a strengths-based approach rather than focusing on deficits. In school, I was trained to look at what's not there instead of what is there. Instead of looking at those needs first, at what's missing, try finding the strengths first and help those families build confidence and hope. Many families, unfortunately, have only heard what they're doing wrong and never have anyone tell them what they're doing right and help build up their own confidence. Partner with youth and parents in all aspects of care and within their culture. Ask them what they want to accomplish, what their goals are. And I urge you to challenge your own assumptions and biases regarding parents and families. Redefine dysfunctional, or better yet, don't use that at all. We usually define it through our own lens, how my family functions. And if you don't function like my family, then you must be dysfunctional. In all honesty, if a family's getting their needs met, they're functional. Consider what your role and services look like from a family's perspective. What if it was you walking in that door? What would it be like if you and your child walked through the door, went through an intake, told your story? How would you feel if you did that within your own organization, within your own system? Then use that perspective, use that feeling to make your processes fit and support families. They'll be more engaged. Maintain clear, respectful, and consistent communication with family and other providers, even when you disagree with them, because we're going to disagree. We're going to have different perspectives as we come to the table. And model partnership with families and with each other. You're a team with the same goal, which means that each person does what they do best, and you're accountable to each other for doing that. If you're a manager or an administrator in an agency, you have a really influential role in how your program or organization does its work. For you, a system of care approach means that you intentionally set the tone for your programs and agencies through these different ways. the language and the terminology you use regarding families. Consider how you refer to families. Are they cases? Are they appointment times? Or do you consider them your customers, your guests, if it's a residential treatment facility? Something this simple can have the greatest impact on how a family interacts with you. The physical environment, make it welcoming and comfortable, not intimidating. Having to go through the front doors of a juvenile court is intimidating. You don't know the processes. People are armed. You have to go through a metal detector. You may be seeing your child in handcuffs. Be aware of what the environment looks like. Have spaces for kids. Keep them clean with lots of hand sanitizer. Offer coffee and water. What is the attitude and the agency culture? You can set the tone for that, ensuring that the culture within your agency is one of respect and partnership with parents and emphasizes a team approach in working with families. Target your staff training and support to implement system of care values and principles. Support your staff to change to this approach. Have policies and procedures that are respectful of family time, roles, and culture. Now, this can mean that you have to adjust staffing patterns. I get it, that's not easy. But if you could work outside normal business hours and support your staff to have days off that look different, and outside a clinic setting where families can more easily get to you, as well as a reduction in paperwork. And what are your follow-up procedures for missed appointments? Do they encourage engagement in services and help that family to continue with the services that are needed rather than penalties and being penalized for missing appointments and being discharged without any further contact? Again, isolating. And have collaborations with other providers and community groups. No one agency can meet the needs of all families. Involve youth and families in your program design, in your evaluation of your programs, and all of your continuous quality improvement processes. Then use their input. It's nice to do a focus group, but then families are left with, what are you going to do with that? If I don't see any change, what have you done with the information I shared, the suggestions I had? Model partnership and a team approach in your interactions and work with other agencies, your staff, and in the community. That could be a streamlined referral process. You could establish ways to share information so that the family's not telling their story over and over again. And yes, you can do this in a HIPAA-compliant way. Explore ways to partner, to offer services within your expertise and partner with those who have other expertise. Integrate young adults and family members into your staff, into your management, into your advisory roles within the agency. When you bring in that lived experience, it offers helpful perspectives for improving your approach, as well as it broadens your ability to truly support children and families. As a funder, or someone who establishes and monitors contracts for services for families, employing system of care values and principles involves how you choose what you fund and how you use those funds. Strategies may include asking youth and families what they want. Novel idea, isn't it? Ask them what's working for them, what doesn't work for them, and then target funding to what they find most beneficial. Create advisory mechanisms where youth and families inform funding decisions and they evaluate the outcomes. And again, use what they tell you. This can mean including youth and parents in shaping what types of programs you fund or participating as members in your grant review process, even the award process. Analyze current spending and utilization patterns. Are there disparities? Is there disproportionality in access? Are there expenditures or funding that's associated with poor outcomes? Don't continue funding things that don't work. Consider realignment of funds. Seek flexibility, coordinate across different systems, and redirect dollars to more effective approaches. and include family-driven requirements in contract and grant language. This could mean that you require anyone receiving the funding to go through training in the system of care approach and the principles and values. It could mean establishing a feedback loop with youth and families served as part of your data collection process and a part of continuing to improve the programs that are available to families. Track the implementation, track the outcomes. And I mean more than a checkbox on a sign-in sheet that you're a parent. Also support diversity in service providers and in programs that families report work for them and that work with them. It means not distributing funds and setting up contracts the way you always have. I get it, change is not easy. And it may mean putting new standards in place for an organization to continue receiving those same funds or at the same level. But if you are in this to support children and families, then your approach has to be one that is informed by them and that focuses on using funds in the way that most benefits them. Finally, policymakers and system leaders. Your role can be the one that embeds system of care values and principles long term. For you, that means analyzing current policy and practices with youth and families to garner their input and their suggestions. Establish policy processes that incorporate representation and voting authority, decision-making authority, of those that will be directly impacted by the policies that you're generating. Always consider policies from the family perspective to avoid unintended consequences. If you keep in mind, what if this was my child? What if this was my family? How would I want things to work? Codify policy changes for sustainability and continued progress. You can increase the likelihood that successful programs and approaches continue regardless of changes in administrations or leadership. Change policy to support partnering with families at the policy, funding, and service delivery levels. Build young adult and family involvement into the policy-making process by incorporating them as voting members and establishing quotas for their involvement. You don't meet unless they're there. There are a few sites that have actually accomplished this. Establish workforce standards that are aligned with system of care values and principles, including certification, reimbursement processes for diverse types of providers and programs, training requirements, and expanding roles for those with lived experience. Could do a whole other talk about that and how beneficial they are at every level in the system. Maybe I'll get the chance to do that some other time. As with changing any behavior, this takes time, it takes intentionality, and it takes commitment. I think Tennessee's been working toward this approach since Nashville Connection in 1999, and we're making progress. But change isn't easy. We must continue to be consistent in this paradigm shift. We have to support and encourage one another from your individual role. Let's hold each other accountable for living the system of care values and principles, not just something that we read as it's laid out on the table or posted on a wall. Model family-driven care in your interactions and within your role and responsibilities, because we do all have a piece of that puzzle that paints that larger picture. Ask and then use what families and youth tell you about what works for them. You know, you've got others that are rooting for you. You can seek ongoing training and technical assistance to support your work. Fredla was founded on this idea. Family-run organizations across the nation are founded on that idea. You have a strong system of care contingent here. Call Carrie. Talk to her. No question is wrong. Call Melissa McGee, the Council on Children's Mental Health. How can you be involved? Do you have something to contribute? There's many ways that you can contribute and be supported in your work. So if we're all aware of and target our approach to be more collaborative with each other, to build partnerships with family and do with instead of to, and respect the expertise and experience that each of us bring to the table, to support children and youth, imagine how that would impact your work. Using such an approach at one level radiates to the other levels and builds that comprehensive, coordinated system we've been working toward for years in Tennessee, truly a system of care for our kids. I think I'm the last speaker for this year's CAD. So I want to leave you with this one thought to carry with you as you head home and as you go back to work and back to somewhat normalcy. Regardless of your role, regardless of your job, regardless of your position, it's truly all in your approach. I want to encourage you to get back in touch with your purpose for working with children and families and use that in your role daily to take the ideas you learned here and put them into action. Thank you for having me today, but more importantly, thank you for all that you do for Tennessee's children, youth, and families.